Hi, I'm Jessica Schlicker. I'm a family doctor. I'm making you a quick video to show you what Pearl is and be happy to answer any questions at all. So for basic orientation in Pearl, when you open it, it's going to look like this. Your search bar is at the top. You can specify if you want adult or peds. And then it's aware of what chart you're actually in at the time that you're using it. And over here, you can give feedback, which we continually use to improve the platform. On this side, it'll tell you how you're logged in as well as your CME, which is also easy to claim, 15 minutes for every time you look something up. So MedPearl was created inside of Providence to help people as a clinical knowledge hub, distilling down common questions to specialists and primary care docs into one place so you can find your answers quickly. I'm going to show you a couple of the ones that I like the best. The story I like to tell is actually my own mother. She had a pulmonary nodule that was found incidentally. And so I looked, this is actually a 60-page American Thoracic Society PTF that's distilled down into just a few clicks. So if I say, okay, look, I have an incidental pulmonary nodule, right? Does this patient need to be referred? Does this patient have cancer, right? Normally, that's kind of a complicated thing to figure out. So I'm clicking on an incidental nodule, and Pearl is aware that of the patient's chart that I have open. So it's going to tell me all of the CTs that are in the EHR. So that's the key part. The patient-specific data is on this side, and then this is the algorithm that was created from the best practice guideline. So for this patient, there's no crazy things happening. It was an isolated solid nodule. It was small. She's not a smoker, and I had no previous CT. So quickly I can put in the things that are most relevant for my patient. And I can see that for this particular patient, she doesn't need a referral at all, right? But if she had had some concerning symptoms, you might want to refer her urgently. If she had had, you know, a ground glass appearance, or it was bigger, or she was a smoker, or it was changing, then it would tell you exactly what to do, repeating the CT or referring them to thoracic or pulmonary, and with what timeline. We have been scaling within Providence. This has been used without any hard stops or requirements in the EHR. We have over 7,000 physicians and APPs using it. So it's really an exciting tool. And I'll show you one other. This is the one we just showed with the buttons. That's called an algorithm, but this is a guide. So there's both formats. And for this, we have up here clinical notes. This is your 2-minute summary of what to know, any orders to consider for this specific patient, and then if you'd refer them to whom and with what urgency, and then some resources for where we got the information. If you look here at orders to consider, you can see that for this specific patient, it actually pulls in some stuff I really need to know, right? Like, has the patient had a white count recently? Has the patient had any inflammatory markers? Have they had a uric acid? They don't necessarily, need those things for gout, but it'd be nice to know if they've had them done. And then specifically, we want to know what's the creatinine and the liver function. And this pulls the patient's specific data into the algorithm. I'd be happy to answer any questions. Thank you so much for taking a look. And I'll stop now trying to keep it real brief. Thanks so much.